Different conditions and injuries can lead to stiffness and pain in your hip joint. This can make it difficult to move around and look after yourself. The aim of this video is to help you understand what a hip replacement is and what you can do to help yourself recover after surgery. An orthopedic surgeon will recommend that you have a total hip replacement when the pain and stiffness in your hip starts to interfere with your everyday life. You can expect to experience moderate to severe pain in your newly operated hip in the days following the surgery. It is very important that you exercise your operated hip already a few hours after you have come out of theatre, even if it is painful. When your anesthetic wears off and you have good control of your legs, a nurse will help you perform the first exercises safely. A physiotherapist will help you walk your first steps away from your bed the morning after your surgery. If you exercise and mobilize early, you will have less pain and recover more quickly. Your surgeon will hand you a booklet containing important information about what to expect from your surgery. You can stick this booklet on the fridge and read it to remind yourself of how best to prepare for your surgery. If you are well prepared for your surgery, you will likely be less anxious and worried while you are in hospital. It is very important that you know how to exercise your operated hip safely and that you have prepared your home for your return from hospital. Remember to bring the following with you to the hospital: chronic medications, toiletries, book or entertainment, walking shoes or tackies, clothes for going home, walking aids, snacks. Don't bring valuables except for phone and charger. Before you go to hospital, you must make sure to arrange for a family member or friend to pick you up when you are discharged. Also, make sure you can stay with a family or friend who can help you the first week. If that is not possible, please contact the orthopedic preoperative clinic before your hospital admission so they can assist you in making a plan. You will be admitted to hospital the day before your surgery and will first go to the admissions office before going to the orthopedic ward. Once you have been given a bed, you will be seen by an orthopedic nurse and doctor who will instruct you in taking a bath with an antiseptic to reduce risk of post-operative infection. An anaesthetist will come and talk to you about the type of anesthesia and pain management for your surgery. Remember, it is not a pain-free procedure, but we will do our best to help reduce the pain. Remember to eat and drink as normal until midnight. Watch the exercise videos on your phone and practice your hip mobilization exercises. Practice how to get out of bed safely. On the morning of surgery, remember to take the prescribed medication with sips of water and go to the bathroom to empty your bladder. The scrub nurse will greet you in the front room of the theatre and ask you questions. They will make sure you know what surgery you are having and that any allergies have been documented correctly. During hip replacement surgery, the surgeon will cut either on the front, side or back of your hip and remove the damaged ball and socket from your hip joint. An artificial joint made of metal, plastic, ceramic, or a combination of these materials will be fixed into the bone using bone cement or special coatings that bonds directly to the bone. Your surgeon will close your skin with stitches or clips. A dressing will be applied over the wound area. When surgery is complete, you will be taken to a recovery unit. A drip will continue to provide fluids and pain medication. Elastic stockings will be on both your lower legs to decrease the risk of deep vein thrombosis. In the recovery unit, your blood pressure, heart rate and breathing will be observed by a recovery room nurse. Special attention will be given to your circulation and sensation in your legs. If you become nauseous or your pain is poorly controlled, the nurses will give you medication to make you feel better. Some patients will stay in recovery high care unit. Others will be moved back to the orthopedic ward. You can expect to start feeling moderate to severe pain when the anesthetic wears off. The nursing staff will give you pain medication to help manage the discomfort, but please be mindful that recovering from a hip replacement will not be pain-free. When you wake up from your anesthetic and you feel you have good control of your legs, the nurses will come to you to instruct you in how to safely start exercising your newly operated hip. We also aim for you to sit with your legs over the side of the bed for the evening meal if you have good control over your legs. If you eat, drink and mobilize early after your surgery, and if you take your prescribed pain medication, you will recover faster. On the first morning after your surgery, we will take off the monitoring, cap the intravenous line, and remove the urine catheter if you had one inserted during surgery. A physiotherapist will come and assess your leg strength and ability to start walking. We aim for you to walk minimum 10 steps during this session. You are expected to do the exercises shown in the exercise video on your phone a minimum of 3 times per day. Once the physiotherapist has assessed it is safe for you to walk with assistive devices and nursing help, we expect you to walk at least 2 to 3 times per day. You will also be expected to have most of your meals in a chair next to your bed or with your legs over the side of your bed. All these measures are for you to get the most out of your stay with us and to help you recover as fast as possible. You can expect to be ready for discharge from hospital 2 to 3 days after your surgery. You will be discharged with walking assistive devices as needed. You will be given a script with pain medication. We will give you an appointment for a 2-week wound checkup, a referral letter for ongoing outpatient rehab or physio, and we will give you a home program to assist you in your hip exercises at home. But please continue using the exercise program on your phone. You will come back for a checkup with your surgeon after 6 weeks in the orthopedic clinic. Please monitor your wound dressing at home. If your hip starts swelling up or the wound starts leaking fluid or pus, you must urgently visit the emergency unit in the hospital where you had your surgery. You can expect the surgery will improve your quality of life, but it will take months before your newly operated hip feels like your own and for the pain and swelling to subside completely. However, if you take the prescribed pain medication and perform regular exercises, you will recover faster.